On the Scene video coverage of AHA 2012 is supported by Pradaxa.
Welcome back to On the Scene at AHA 2012. I'm delighted to be joined by the Vice Chair of the program and Chairman of Medicine at Stanford, Bob Harrington, and Editor of JACC, Tony DeMaria. And a lot of big trials. We have several in the lipid field, and AFib ablation was presented today, so some very interesting results. I think the biggest of the trials was looking at a way to increase HDL. The dal-OUTCOMES trial looked at dalcetrapib in a huge trial, 15,000 patients in the early post-ACS setting, and found absolutely no benefit on preventing cardiovascular events, despite about a 30% increase in HDL. I think this is a hit on the HDL hypothesis. What was your sense of what this brings to the field?
Well, I mean, it definitely makes you take pause, because we've had a couple of hiccups along the way in the HDL story and trying to understand if actually that the clinical trial evidence can support the epidemiologic evidence, which suggests that higher HDL is good. You know, Chris, I think there's some issues here, one of which is 30% increase enough? Is there something about this particular drug? I don't think we know the answer to that. Fortunately, there's other studies going on, including ones that have a more profound influence on HDL. And maybe it's not the right patient population either. So I think there's still some questions. I wouldn't discard HDL quite yet.
Yeah, I'm not, well, you know, whether CTEP is the best way to increase HDL, there's more and more emphasis on the functional aspects of HDL. And in fact, the CTEP mechanism may in fact not give you the functional HDL you need. The investigators postulated a slight increase in systolic blood pressure, a slight increase in CRP, and they said maybe that influenced it, but you know, I'm not going to buy any stock in companies making CTEP inhibitors for a while anyway.
But keep drinking your red wine and raise it a little.
Right, exactly.
I think healthy approaches, but I think it is true that this is more complicated than just lowering LDL. Yeah. But on the lowering LDL side, there are at AHA a whole series of studies with the new PCSK9 antibodies that have very profound effects, and several trials presented. One of them was the GAUSS trial, also co-published in JAMA, looking at the statin-intolerant patient population. Pretty dramatic LDL lowering that was seen. You
know, time after time, the lowering of LDL with these PCSK9 inhibitors has been very impressive here in statin-intolerant patients, but of course there are other studies out there, one of which we published. When you add them to a statin, you get dramatic LDL lowering. So this is an important mechanism, I think.
Yeah, this is a big story that and as you say, Chris, there's a series of these relatively small trials all gearing up now for the large trials that are going to be done, and you can certainly have a very profound, as Tony said, and a very predictable decrease in LDL, and whether or not, as we've all talked about, is this a continuing straight line of benefit, or is it going to plateau, and we just don't know.
Yeah. Certainly having a big pharmacologic effect will allow the study to evaluate whether a non-statin way of lowering LDL will be of benefit. And I understand one of the outcome trials has just started and several others getting planned.
Yeah, it's subcutaneous injection, so for some patients that may be a little bit undesirable, but on a monthly basis, not too bad.
Yeah, I mean, if it actually reduces the risk of serious events, I think people, you know, part of the issue of the trials is going to be to figure out how do you get people to adhere to a more complex type of therapy than maybe many are used to.
Yeah, very good point. Well, shifting gears a little bit off to atrial fibrillation and ablation, a very interesting study, a small study in just under 50 patients, but looking at AFib ablation as a strategy in heart failure patients, where in theory getting back into sinus would have the biggest impact. This also has, I guess, under review, but I should say, but the findings looked very favorable for left atrial size and other hemodynamic parameters. You want to comment?
Yeah, interestingly enough, in these heart failure patients, their endpoint wasn't just normal sinus rhythm, but peak VO2 and exertional capacity, and they had biomarker evidence of benefit as well. So a very positive trial for ablation in heart failure. Having said that, quite small, 52 total patients. In addition, they achieved an over 90% success rate for sinus rhythm at the end of 12 months. The most successful results ever achieved. And so one might interpret it as evidence that if ablation can be that successful in heart failure patients, then maybe in fact it is of benefit.
Yeah, you'd like to think that if there was a group, as you've indicated, Chris, that's going to benefit from restoration of sinus rhythm, you would think it's our heart failure patients. So as Tony said, if you can do a study where you can pull off this kind of successful ablation, it's worth exploring. I mean, certainly the preliminary data look good, look intriguing. Yeah. It's going to require a lot bigger study to hang your hat on it.
And I guess there are some larger trials in progress?
Cabana's a study that's been underway for a while now, an HLBI-sponsored trial trying to understand the role of ablation in a certain population of older people with AFib. So still underway.
Oh, terrific. Well, we'll want to mention two other interesting pilot studies. One of them looked at sildenafil for diastolic dysfunction. That's another one of these vexing problems that we have lots of patients and really nothing different that we could offer. So an intriguing study to see whether PDE inhibition could be helpful, but it unfortunately didn't see a benefit in terms of hemodynamics. Again, a small study.
Yeah, a small study, surrogate endpoint. So even if it was positive, we'd probably be saying, well, but it's negative for filling pressures as a surrogate endpoint. There may be lots of reason to take sildenafil, but diastolic dysfunction doesn't seem to be one of them.
Okay. And then finally, another intriguing phase 2 study looking at another anti-inflammatory drug that the name is losmapimod. That's a MAP-P38 kinase inhibitor, so aimed at decreasing inflammation on a plaque. I think some intriguing results, the SOLSTICE study. You want to comment briefly on what was seen?
The SOLSTICE trial, you know, my conflict here is that I work with Drs. Newby and Granger who were involved with the study. I was not involved with the study, and it is intriguing. I mean, I think we've gotten to a point where antithrombotic therapy, we may have tapped out the level of benefit. Still some tweaking to do, but we need a new approach to managing patients with acute coronary disease, and an anti-inflammatory approach may well be it. We heard from colchicine.
Yeah.
Now we're hearing from a very targeted anti-inflammatory. They showed an effect on some biomarkers, not an effect on other biomarkers. I would sum it up, Chris, as maybe a typical phase 2 trial. Some things go in the right direction, some things don't move. If you believe in the hypothesis, probably worth exploring.
All right. Well, as you can see, a wide range of very exciting trials, and stay tuned with us as we cover more of the late-breaking clinical trials here at AHA 2012.